Hello coders, welcome to Fast Coder 21 free medical coding YouTube channel. Today we are going to learn mastering endoscopy medical coding procedures. As all of us know, while coding procedures using CPT and ICD-10 PCS, most of the time we will use endoscopy procedures. Coding endoscopy procedures is little bit confusing and problematic. But after watching this complete video, you can reduce your confusion and complications. If you are visiting for the first time, please click on subscribe button. If you like this session, please click on like button to motivate and inspire us. First, we need to learn what is an endoscopy. So, an endoscopy is a procedure that allows a doctor to view inside of person's body. Doctors use it to diagnose diseases. So, basically, endoscopy is a procedure where physician will use inside a person's body. So, basically, scopy means visualization, endo means inside. So, in order to visualize inside the body, physicians will use endoscopic procedures. So, most of the endoscopy procedures used by inserting in the natural orifices. Next, what are the common body parts for endoscopy procedures? So, these endoscopy procedures are mostly utilized on esophagus, stomach, colon, ears, nose, throat, heart, urinary tract, joints, abdomen, and few more. For example, if you take esophagus, you have esophagoscopy. So, esophagoscopy is an endoscope. Using esophagoscopy, physicians will check abnormality in the esophagus. For example, if you take stomach, we have esophagogastroduodenoscopy. So here, physician will check esophagus, stomach, as well as the duodenum. So if you take colonoscopy, physician will check the colon. Usually, we will call it as large bowel or large intestine, where physician will insert endoscopy in the anus and he will check until the ileocecal wall. For example, if you take nose, most of the nose and sinus procedures will be performed using endoscopy. For example, if you take urinary tract, here physician will use cystoscopy and he will check the urinary tract. So cystoscopy is an endoscopy or endoscopic procedure. So what is an endoscope? So, an endoscope is an apparatus. During an endoscopy, the physician inserts a tool called an endoscope into a person's body. So, basically, endoscopy is a procedure name, and the procedure by we will perform endoscopy is the endoscope. Most of the endoscope are thin tubes with a powerful light and tiny camera at the end. So basically the endoscope's length and flexibility depend on the part of the body the doctor needs to see. For example, if you see esophagoscopy, only little small amount of endoscope length is enough. For example, if you take colon, in order to check complete colon, we need to have longer length endoscopy or colonoscope. For example, if you take straight endoscope, generally physician will use straight endoscope for looking at joints. But if you take colon, we need to have flexible endoscopy. So flexible means we can maneuver the endoscopy whatever we need or whenever or wherever we need to insert. So here we need to remember that we have straight endoscope and flexible endoscope. So we need to learn what are the other tools needed with an endoscope. So basically, an endoscope has a channel through which the doctor can insert tool. So, so it is like a flexible tube or straight tube. So in order to perform the intended procedure, physician needs to insert few tools inside the endoscope. Those tools we are going to learn now. Physician will use flexible forceps. So these are long leg tools. They will use it for tissue sample taking. So if the physician wants to take the tissue sample, physician needs to use flexible forceps. And also we have biopsy forceps. It is the tool which will used by the physician whenever he wants to take biopsy from the targeted organ. And also we have cytology or cytology brushes. These take cell samples. So and also we have suture removal forceps. This will remove stitches inside the body. So for example, if physician wants to take the tissue sample, physician will use flexible forceps along with the endoscopy. So for example, if physician wants to take biopsy samples, physician needs to use biopsy forceps along with the endoscopy. So for example, if the physician wants to take cytology samples, physician used to use cytology brushes. So using the endoscopy, if the physician wants to remove the sutures, physician needs to use suture removal forceps. So these are the tools: flexible forceps, biopsy forceps, cytology brushes, and suture removal forceps. So based on the requirement by the physician, physician needs to use these tools. So why do we need endoscopy? So basically the most important purpose for endoscopy is to screen for and prevent cancer. So for example, physician will use a endoscopy called colonoscopy to screen for colorectal cancer. So during a colonoscopy, what happens? Physician may remove growths called polyps. So without removal, polyps could develop into cancer. So in order to find the cancer, physician needs to use the colonoscopy. Using the colonoscopy, physician will remove the polyps. So if the physician does not remove polyps, it will convert into a cancer. So in order to check colon cancer, physician will use colonoscopy. So second one is to diagnose a disease or find out the cause of symptoms. So the type of endoscopy physician will recommend depends on the part of the body under examination. So for example, if it is a colon, physician will use colonoscopy. If it is the stomach problem, physician will use EGD. So for example, it is a joint problem, physician will use straight endoscope. So and also physician will use endoscopy for treatment. So what happens during the treatment? So treatment may involve an endoscopy. For example, if you take laparoscopic surgery, which is also a endoscopy, physician will create incision on the skin in order to place the laparoscope or endoscope. So now we will learn types of endoscopy. So here first column contains name of procedure. So for example, if you take here name of the procedure, name of tool, area or organ viewed, how endoscope reaches target area. So for example, if you take anoscopy means here physician will use anoscopy. So ano means anus, scopy means visualization. So in order to check the anus, physician will use anoscopy and the tool we will call it as anoscope and area or organ viewed is anus and the rectum insert through the anus. For example, if you take arthroscopy, it is an endoscopy. Here, physician will use arthroscope. Usually, we will use it for joints. Here, inserted through a small incision over the joint. Next, we have bronchoscopy. So, we will use the tool called it as bronchoscope. Here, we will check trachea or main pipe and the lungs. Here, usually, physician will insert bronchoscopy through the or bronchoscope through the mouth. And next, most importantly, we have uh, cystoscopy. It is basically used for the bladder in order to check inside the bladder. So, and also inserted through the mouth. Colonoscopy. So, in order to check the large intestine, physician will use colonoscopy, where physician will insert colonoscopy through the anus. And next, we have colposcopy. Here, physician will check vagina and cervix. So, here, colposcope placed at the vagina's opening after a tool called speculum dilates the vagina. It is not inserted in the body. So next is cystoscopy. So cystoscopy, by using cystoscopy, physician will check the bladder. So physician will use cystoscopy through the urethra. And we have esophagoscopy. Here physician will use or check the only esophagus inserted through the mouth. And we have gastroscopy. Here gastro means stomach. So here stomach and duodenum, which is the beginning of the small intestine. Here also uh, gastroscope will be inserted through the mouth. And next one is proctoscopy. So procto means rectum. So here rectum and sigmoid colon, which is the bottom part of the colon. So for proctoscope also, physician will use the anus is the starting point. And we have sigmoidoscopy. So usually based on the part of the colon, like sigmoid colon, we have sigmoidoscope. So here physician will check sigmoid colon, and here physician will insert sigmoidoscope through the anus. And next we have thoracoscopy. Here physician will use thoracoscope. So in order to check pleura, which are the two membranes covering the lungs and lining the chest cavity, and structures covering the heart. So it will be inserted through a small surgical opening in the chest. So in order to code endoscopy properly, you need to know the what is the exact procedure of the scope. So for example, if you see in the documentation colposcopy, so you need to understand that what is the purpose of colposcopy and what is the entry point for the colposcopy and what is the purpose of this one or purpose of colposcopy. So for example, if you take cystoscopy, you need to remember that cysto is bladder, scopy is instruments or visualization. So in order to check inside the bladder, physician will use the cystoscopy. Thank you guys. Thanks for watching this session. So if you like this session, please click on like button and also share passcode 21 to your friends in order to know latest medical coding updates. Thanks for your patience guys and happy coding.